This is Intro to Kinesiology. This is Module 2, and this is the stretching activity. We'll talk a little bit about stretching, and we're looking at it as an application of anatomy, understanding how we would use that in our future profession. And then it's just kind of a follow-up for the activity that if this was a live course, you'd be doing live, or if you happen to miss that to be able to make up for the online, or if this is the online course, this is the independent activity that you'd be doing on your own. So as you recall from the human movement system, all movement here is, we look at the study of human movement kinesiology, but all movement that occurs is a product of these three systems. So you have the articular system, the joints, the joint capsule, tendon, ligament, and fascia that's holding everything together. Movements occurring at the joints where the two bones are coming together. Those joints are 100% dependent upon the muscular system. The muscle can only do one thing, which is contract, which is generate tension. So it's either on or it's off. It's either generating tension or it's relaxed. And it can only do that if it's getting a go signal from the nervous system, and the signal is either on or it's off. So the nervous system regulates muscle tension. Muscle tension regulates joint movement, and then all those things result here in that movement. So when we look at range of motion, the availability of a joint, it is dependent upon the structure of the joint. It's dependent upon the muscle relaxation or contraction of that, and it's really based on what's the nervous system telling it what to do. So often people look at tightness, right? They always talk about they have tight hamstrings or tight calves or tight shoulders, and they say that their muscles are tight, but a muscle tension, muscle tightness is really only muscle tension. Muscle tension only exists if the nervous system tells it to. So when everyone complains about their stiff, tight muscles, what they're really talking about is, why is my nervous system, why is my brain telling those muscles to be tight in the first place? And what we're going to talk about in this, so what's going to happen is we're going to do this activity, and there are going to be some questions that are generated. Is stretching good? Is stretching bad? Is there different types? And that's kind of the basis of our library research project. And hopefully you'll have some more answers and diversify that stretching is not simple. It's not complex. It's complex. It's not as simple as just go touch your toes and try to do the splits and you'll be great. There's a whole process that's happening here, and a flexibility assessment is giving you a window to the integrity of how is everything at the joint, ligament, joint capsule, how are the muscles, and most importantly, how's the nervous system? So just for your consideration, stretching is not flexibility, right? Stretching is a modality to improve flexibility, but flexibility is just basically what kind of range of motion do you have at the joint? Can you move? Can the tissues extend? And stretching is the modality. So if you think of it like working out, right? Strength training. Strength and weightlifting are not synonymous, right? Strength, lifting weights is one way of becoming strong, but is it free weights? Is it bands? Is it body weight? Right? So it's a different modality. If I tell you to go work out, all of you are going to do very different things, right? Because to you, working out or lifting weights, getting stronger, all have different meanings, different values. The same goes for stretching, but if you go and tell people to go stretch, 9 times out of 10, they're going to do like a passive static stretch where they get themselves in an uncomfortable position, try to push a little bit beyond that and hold it for like 30 to 40 seconds, right? We've been ingrained that way, but what we're going to find is that there's actually multiple ways. There's 4 spectrums, 4 different quadrants that we're going to stretch in. So those 4 quadrants here are right here. And hopefully you read there was an article posted, 2 primers that looked at like terminology, and it introduced you to these concepts of active versus passive and static versus dynamic. So if you haven't read through this, I'd maybe pause the video now, pull that up. It should be 1 or 2 links below it. Read those. It's like 2 pages, right? Look at it and then come back to the video here. But basically you have these 2 spectrums. You have stretching that's either active or passive. So active meaning that you physically are involved in that. So the muscle joint, the muscles around that joint are producing the force. Not even you, your hands, but like if you're trying to do hip flexion, like you're trying to stretch your hamstrings, the hip flexors are working. Then you have passive, which is some external force. So either gravity, your hand, or a partner pushing down. And then you have the continuum of static versus dynamic. So static, is it a controlled hold or is it more of a dynamic, quite rapidly changing type of aspect, right? So those are your continuums, and really stretching falls into one of these four, right? So it's either like an active static or an active dynamic, or a passive static or a passive dynamic. So stretching will fall into one of these four, and there's some different stretching techniques out there that might be a combination of like an active static followed by dynamic passive, but for the most part they're categorized in these four. What that looks like, so your passive static stretching is what most people traditionally think of stretching, where you're trying to lengthen the hamstring right here. Let me pull up my laser pointer. So right here you're trying to stretch this part of the muscle, and so either a partner or gravity or someone, your hands even, are pulling your leg back, right? We have active dynamic stretching, which is kind of the ballistic stretching, like the warm-ups, the high knees, the butt kicks, even just warming up. Like if you're going to go for you're going to sprint, you would do some jogs or running. Now there's some debate that might be passive dynamic, but passive dynamic, remember, passive means that you use some external input, someone else is doing the force. So like a joint mobilization or a spinal adjustment or manipulation that way would be a passive dynamic, because you're rapidly moving, but someone else, you can see here the practitioner is taking this patient through maybe knee and hip flexion. You have active static, so you're getting to a position and holding. This would be like an isometric or kind of a positional hold, but again, you can be stretching the same aspect, but the leg's coming up, but instead of the leg being forced into that position, you are trying to generate that through the muscles that are surrounding that joint. So those are your four quadrants. Like I said, there's some debate whether it's like this ballistic movement or like a hold. And I would sometimes argue that the active dynamic, the ballistic, is actually passive, because you are initiating the movement. But let's say you swing your leg, you're trying to kick your leg high. That leg movement going up this way is along for the ride. It's momentum, so it's actually a passive movement. So there's different aspects there, but what we're going to focus on is just like this static stretching, either passive or active. So here's some examples of some active range of motion here, passive range of motion there. This is kind of tricky. Most people would say that this is active, but it's actually passive, because gravity is pushing down, trying to pull the torso here, so that's a passive movement. Here is the partner assisted stretching. That's the fun one, right? Some people really love it. I hate it. Most people do. So, and then you have your leg swings again, which would be more of a dynamic type component. So the first question is why is flexibility important? Why do people do it? I kind of joked a little bit that when I think of stretching, it doesn't bring good feelings to me. Some people love it. They love doing it, but also people like running marathons. They feel great. I think that you're better off hitting yourself in the head with a hammer, but that's another story. But it's different strokes for different folks, right? People like different things. I'd rather do some high intensity type stuff, and people are like, no way, right? Everyone kind of adapts and they gravitate to what they naturally are good at. But just think for a second here. Just take a minute and think of like, why do people stretch? If you stretch, why do you do it? What are your goals? What do you hope to achieve from it? What do you think it's actually doing? And is there any risk, right? Is it more is better and it's gooder all along, right? So just take a minute and think about that. So these are the stretching goals that most people come up with. So we look at like, why do people stretch? It's kind of the stretching goals and what it's supposed to do. And then what we'll follow up with is there any risk? And the answer is yes, there is. And different types of stretching have different risk versus benefit. And this is true for everything you're going to be exposed to in your fitness career, whether it's nutrition, whether it's cardiovascular exercise, whether it's resistance exercise, strength training, whether it's flexibility, whether it's sport. There's a risk versus benefit, and it's up to you, the practitioner or the individual, who makes those choices, right? Do I need to do this exercise? Why? If not, is there a better one that I can do that's more bang for my buck? And that's really what you're going to be doing for your entire fitness career, whether it's physical therapy, medicine, chiropractic, or even journalism, right? Are you the most effective in what you need to say? Are you doing the most bang for your buck? Do I say that to be provocative, or is it risking my career and I might get canceled in our cancel culture, right? So it's risk versus benefit. You're always making these judgment calls. And so stretching, flexibility also follows suit. But the main reasons why people stretch is they want to increase flexibility, range of motion, and their sport might determine it. A lot of people think that the increased range of motion leads to injury prevention and performance enhancement, but that's not necessarily the case. A lot of people stretch, and let me just clarify too that stretching and warm-up are not the same thing. A warm-up is increasing blood flow, increasing tissue temperature, prepping the nervous system, kind of ramping things up, increasing that threshold or decreasing threshold. But stretching can be part of a warm-up, but stretching is in itself trying to increase joint range of motion. And a lot of people do it for performance enhancement. They want to be better on the court, faster on the field, a new PR and a max. So, and then some people just are gluttons for punishment. It feels good, right? So we kind of I put that in there as a little bit, but those first three are your primary reasons why people stretch, right? So there's not one single type of stretching, right? Just as there's no single type of weight training exercise. And what we're going to do next, like there's really not one, nor there's one tool for the job, right? There's a best tool for best results, but different strokes for different folks and different situations, right? You might have someone that has a knee issue or a back issue or an arm issue, and you might need to come up with different aspects, right? Medical conditions, sports, needs, whatever it may be. It's good to really diversify your toolbox and make sure you're not a cookie cutter approach trainer or physical therapist. Make sure that you're diverse in terms of your ability to work with multitudes of people, multitudes of issues, and be able to change when you need to. So what you're going to do is you're actually going to get on the floor and you're going to do some activity. So if you want to listen to the video now, but just be prepared that I want you to jump on the floor and do some stuff here. And if you have a partner, if you want to try to do this with someone and do like a partner-assisted stretch, you can do that. But you can do this on your own. And basically what you're going to do is you're going to do a active static stretch, and then you're going to do a passive static stretch. And you're going to do this with the knee straight for both aspects. And try to keep your leg as straight as possible. Don't cheat. Don't let the knee bend. That's what your body's going to want to do. But it's not important right now. I can't tell. I can't see. But you're going to do is you're going to lay on the ground, and you're not going to touch your leg. You want to make this totally active. And you're going to lay there, leg straight, lift your leg up as high as you can, and try to bring it there, and then hold it there for about 5 or 6 seconds. So you can pause the video and do it. And then what I want you to do is you can either move on to the next stretch or do it on the opposite side now and see if you get the similar response. See how far your leg comes up. See if it's the same. It should be. If it's not, just make note of it. And lift your leg up as high as you can. And I really want you to focus on what you're feeling during this leg raise, right? Again, you're not touching your leg, and I want you to focus on, is it the front of the leg, the back of the leg? Is it cramping? Are you shaking? Is it hurt? Is it hard to do? Do you feel stretch at all? And then go ahead and put your leg down, take a break. And I want you now to do the passive straight leg, so knee straight, leg flex, so your traditional hamstring stretch. So keep your leg as straight as possible. You can either grab up the toe if you can reach it or behind the leg. Usually if you grab above the knee, that will kind of help to encourage that. And now do that and pull. And again, I want you to pay attention to what are you feeling, right? Do you feel it at the back of the leg, the front of the leg? Does it feel tight? Does it feel tense? Does it feel good? And there should be a distinct difference between what you felt during the active stretch during what you felt during the passive stretch, right? The active stretch, it's not uncommon to feel some cramping or some contracting or even some shaking at the front, at the anterior component of the leg here. And then when you do this leg, that this is all kind of calmed down, and what you're feeling here is the back of the leg. It's also not that uncommon for you to do an active stretch and feel it in the back. That just means that for you, your agonist in this aspect is strong enough and your antagonist is truly the issue, right? For those that felt the cramping here, you don't have an antagonist. You don't have a muscle tissue issue. You might have more of a neurological component. So that passive stretch can be done like this, or you could put a belt loop around there or a band or whatever. So these were both done with the leg straight. I want you to do it again. So you're going to get back down on the floor, and you're going to do it this time with your knee bent. So you're going to give your hamstring some slack. So instead of the knee being straight and the muscle being lengthened already through the knee, you're going to give your knee some slack, and what you should notice is you should see an increase in range of motion. So do it passively first, kind of bring your knee to your chest and see how that feels, and Should feel really like nothing. And then do it again. Don't touch your leg, hands off, and then try to bring your knee to your face, right? And then try to drive that knee up as high as you can. And you should feel something similar. You might not feel too much of a stretch here because you've lengthened the hamstring a little bit. You've given it some slack. Here, though, you should, again, might feel some of that cramping there. Not as bad, but you might feel it actually a little bit more because you don't have the hamstring that you're dealing with. And again, just keep note of what did you feel, right? So I want you to do 4 movements again, any order. But this time I want you to determine, when you do this, which one was easiest, which one was hardest, or you can look at it, which one had the greatest range of motion. So which one was the least effort and you had the most range of motion, and vice versa. So go ahead and pause the video and run through those 4 again. So it's, again, straight leg versus knee bent. So leg as straight as possible, no cheating, or leg as bent as you want. And then it's active versus passive. So you are assisting or helping that, or someone's helping you, or you're doing it all yourself without touching, without your hands. So go ahead and pause the video and go through those 4. And now that you're back, you should have determined that it should be really no contest, that the one that was the hardest to do was the active straight leg, lifting your leg up, right? That was the one that was the most difficult and should be the least amount of range of motion, right? Comparatively, relatively. And the easiest one, the one that had the least resistance and the most range of motion, was the one where you're passively knee bent, bringing your knee to your chest, right? Now the 2 in between, it's a toss-up between the passive straight leg or the active knee bent, and it really depends on your strength and weaknesses. But if your normal outcomes for an average population, the first hardest would be the straight leg active, and then the passive straight leg. So straight leg should be the first worst and second worst are the hardest to do. And then the active knee flexed, and then the easiest right there. So kind of that 1, 2, 3, 4 for that. So in a clinical setting or in a lab setting, or let's say we wanted to research this and we wanted to actually measure this. So this was more of like a relative comparison, but let's say you wanted to measure a whole football team or a class, or you had patient population, and you wanted to measure how much actual knee flexion. Instead of looking there and saying, okay, that's how much hip flexion, we'll say, yeah, it's about 90 degrees, minus 1 or 2 degrees. You can actually take this thing called a goniometer, and we can collect that data, and we can actually measure start to finish. And it's very similar to the protractors that you use in math, right? 0 degrees, 90 degrees, 180 degrees. This you kind of put right on the joint axis of rotation. And as I'd shared in the previous lecture, human movement is kind of a wheel axis, and we have 360 degrees to a circle. No joint is able to put us in that position, but from here to there is 90. Half of that is 45. Or a third of that is 30, and you can kind of eyeball, and you have your different angles, like your 90-degree right angle or an obtuse or acute angle. But this is kind of how we measure in human movement and kinesiology. We'll use a goniometer, and we'll measure, okay, you got 30 degrees. Very popular in a rehab setting, particularly with physical therapy, particularly with like post-op joint replacements. We have certain benchmarks we're trying to get patients to, and when someone gets a knee replaced, you want to be at 90 degrees of knee flexion and 0 degrees of knee extension, so full extension, within 3 weeks, right? And the lava is molten, or the clay hasn't hardened yet, and so you want to create a new structural environment based on that new hardware. And it's a race, and so you're measuring day by day. You want to make sure you're getting 1 more degree, 2 more degrees, and every 1 degree or 2 degrees is meaningful, right? Now in a personal training setting or a fitness setting, 1 or 2 degrees is going to be negligible, but you can notice some gross discrepancies like 10 degrees, 15 degrees, 20 degrees. But anyways, you are measuring this, and if you were to collect data, so if you were to take the measurement of the hip at 0 degrees here and measure how much hip flexion, and you kind of see from back up a little bit, and if we took those 4 stretches, the active knee extended, so the AKE, or the passive knee extended, and the active knee flex, so again, the AKE, PKE, so just in the same order that I showed before, but now putting these 3-letter acronyms. Remember, these are standing for active versus passive, and is your leg totally straight, or do you allow your knee to bend? And if you were to graph that, what would happen is you would see most people, the active knee extended would be the least amount of range of motion. Passive would be a little bit more than active. Passive range of motion is always going to be better than greater than active range of motion because you're taking some slack out of that elastic tissue, that connective tissue. And then since the leg is straight, let me just advance the slide a little bit. Since the hamstring muscle is the muscle that's limiting there, it crosses both the hip and the knee. So it's called the biarticulate muscle. And when the leg is straight, you're lengthening at the knee and you're lengthening at the hip. So it's like you're double dipping, and so you're not going to have as much range of motion. But if you bring this hip up and you're lengthening here at the hip, but then you bend the knee, you're giving a little bit of slack there, you can expect an increase in range of motion. So that's why you'll normally see the knee flexed as being even greater. And just as you saw with this here, the ease or which your range of motion, I would be willing to wager there's that 9 out of 10 of you followed this right down the line, right? Now, if we were assessing and we wanted to kind of tease out if there was something that needed our attention or something clinically significant, what you'd be looking at is, and how we do it clinically, is the symmetry. So it's hard for you to compare Jane to John and John to Doe and Susie to Karen, but because everyone's structurally different, everyone is aspect, but it's easy to compare John to John and Steve to Steve and Karen to Karen. And although there is some discrepancy from left to right because of the dominance of the hand and the leg, you should be pretty symmetrical, right? Your joint structure is pretty similar. So where you look at clinically is if the left side is different than the right side. So you should be within 5 or 10 degrees. But if not, right, let's say your left leg, let's say you did this, any one of these stretches, and your left leg got all the way up and no pain, the right side you couldn't even lift up at all, right? There's clinically something going on there. So then the goal isn't really, let's increase range of motion, let's figure out what's going on. The other clinical indication or red flag is the comparison of active versus passive range of motion. Passive range of motion will always be a little more than active, about 5 or 10 degrees, but no more than that. So if you find that you can let's say lift your leg up 45 degrees on your right side and 45 degrees on your, and let's say you can lift it up 45 degrees on your own, but then someone takes your leg and they can push towards 90 degrees, so twice the range of motion, something's going on there. You have a range of vulnerability, right, that you're potentially going to get hurt. You can get your leg only to 45 degrees, but your leg has the option of going from 45 to 90. That's a potential injury there. So again, we would strategize or change the stretching based on those needs. But anyways, that kind of shows how clinically you could use flexibility, or in this case range of motion, and do a clinical assessment on the human movement system and get an idea of, is it a structural, muscular, nervous thing? And this starts our conversation now to the stretching and research aspect, because based on what you need to do, do you have a discrepancy from left to right? Do you have a range of motion issue? Do you have a muscle, a tissue issue, a motor control issue? Most people don't need increased range of motion, so quantity of range of motion. What they need is an increase in quality of range of motion, and passive static stretching is not the tool for that, right? There's different levels of active engagement and so forth. So that's part of our research that we're going to be doing in the library, and you can look at those videos for those future components. But that's our activity here. And like I said, if we were in class, we'd be measuring everyone and kind of discussing a little bit, but hopefully you were able to experience that. And if you skipped through that, jump down on the floor and go through those ranges of motion and just kind of experience and see what you feel. See if there's a difference to left and right. And if there is, shoot me a message on the discussion board and we can work through the issue there.